One of the questions we get is, how do we get results in 30 minutes or less? How can we make a change in something that's been going on for years with your, say, your knee? Well, the thing is, we have specialized techniques that we can utilize that will help bring about that. And usually on the first visit, people will say, yes, that feels better. So some of the things that we may do with you that you haven't had done in the past is, the first thing, we'll use a technique out of Canada called cryogenics. This reconnects the brain to that part, that muscle around the knee, so that it can work better. And we do this, and almost instantly people will say, ooh, ooh, that feels so much better. The pressure's off. So if you take your finger and you mash down on it hard, and you say, oh, that's getting uncomfortable, that's getting uncomfortable. Now just release your fingers a little bit and see how that feels. You notice how that feels a lot better. That's partially what cryogenics does. So understand that that's how we do what we do. Now there's other techniques we use in the office and other things, but one of the things I want to talk about is knee on track. Knee on track opens up that joint space so that we can break up some of those adhesions and scar tissue that have been forming because of that degeneration, and it helps the tracking of that knee also. So then we're going to be doing class 4 laser, which one of the benefits of class 4 laser, we know that it heals, we know that it decreases inflammation, and we also know that it reduces pain. And the reason it does healing is because we now know through research that it stimulates your resident stem cells to do their job again, to wake them up so that they start doing what they're supposed to be doing, which they've been kind of, on the recliner lately. And another technique we use is pulsed electromagnetic field therapy. This is a technique that a lot of the research was, device I should say, that a lot of the research was done by NASA, and they noticed that it would heal tissues 10 times faster than we could our own. And then in March of 2018, they realized why. Because PEMF, pulsed electromagnetic field therapy, enhances the function of your resident stem cells, makes them work better again. And then the other thing is, which a lot of times is a rate limiter, is oxygen. So we're going to check the oxygen levels in your tissues to see, is that a factor that we need to address? So we're going to be using the pulse ox and other ways to see, okay, this is something that we need, because we know that oxygen is a rate limiter when it comes to healing. So think of your car. If you got a full tank of gas, you can drive so far, okay? But what happens when you only have a quarter of a tank of gas? You know that you can't go as far as you could with a full tank of gas. And that's the same way when you come to, if you don't have enough oxygen in your tissues, you cannot go walk as far as etc. before you have to sit down, and we know that the healing process dramatically slows down. Now, the thing is, all these things reduce inflammation, but they don't have consequences to them, say as a steroid shot. Steroid shots, we know, and I never would recommend them, because we know that one of the factors is that it will decrease bone density in that part that you're injecting with that steroid by 8% per injection over a process of 3 months. That's why you'll hear them say, we can only give you three injections per year, because otherwise, if you think about it, you could get up to a 24% bone loss in a year, or those 9 months with that injection. That basically, all you're doing is you're accelerating the degenerative process so that you're in the fast track to have a joint replacement. So that's why I would never recommend that. Now, these cutting edge technologies that we use, and some of the therapies we have, we're the only ones in North Carolina that offers this. And we have other things that also, and the way we find out what we want to do is, you have to come in, we do an evaluation, examination, consultation, and then we determine what do we need to add to that treatment protocol to get the results that you want.